Hello, welcome to another lesson. My name is Nurse JBS, and today I'm going to briefly discuss insulin. Insulin is one of the most popular drugs that usually comes out on your registration exam, which is the NCLEX-RN or PN. You may or may not encounter insulin on your test, but 80% it usually comes out on your exam. But before that, we need to discuss some key terms that you need to know in order for you to know the basics of insulin and for you to answer questions regarding insulin. First, let's talk about onset. Onset is how quickly insulin lowers the patient's blood sugar or your blood sugar or our blood sugar. Peak time is when insulin is at maximum strength. Duration is how long insulin works to lower your blood sugar. So that's onset, peak, and duration. Usually the healthcare provider will prescribe the best insulin to the patient based on several factors. The several factors are how active the patient is, the food that is being taken by the patient, how well the patient manages their blood sugar levels, the patient's age, and how long it takes for the patient's body to absorb insulin and how long it stays active. So usually healthcare providers mix insulin depending on the factors that will be determined. So the types of insulin are your rapid acting, your short acting, your intermediate acting, and your long acting insulin. Those are the generic names. Under rapid acting, we have insulin Lispro, insulin Aspart, insulin Glulicine, short acting or your regular insulin, your intermediate acting or NPH, and Lente. Another one is long acting, your insulin Glargine, and Ultraline. So the trade names for rapid acting are your Humalog, Novolog, Apidra. Short acting or your regular insulin, Humulin R, Novolin R. Your intermediate acting, we have your Humulin N, Novolin N, Humulin L. And your long acting, Lantus and Humulin U. So let's discuss rapid acting. The onset for rapid acting is less than 15 minutes to 15 minutes. And usually, it is taken right before a meal, often used with longer acting insulin. The peak time for your rapid acting is 30 to 90 minutes and the duration is 1 to 3 hours. For your short acting, the onset is 30 to 60 minutes, the peak is 2 to 3 hours, and the duration is 3 to 6 hours. For your intermediate acting, your onset is 2 to 4 hours. Your peak time is 4 to 10 hours. Some say it's 4 to 12. And the duration is 10 to 16 hours. Last but not the least, your long acting onset is 2 to 4 hours. Peak is, it doesn't peak. Only long acting insulin doesn't peak. And the duration is 18 to 36 hours. So your insulin is given via the subcutaneous route. It cannot be given in an oral form because insulin is easily digested with your digestive enzyme. So it cannot be taken through oral form. It can only be given through subcutaneous route. And one important thing to know is you need to rotate the injection site. You need to rotate the injection site to avoid a buildup of fatty tissue, which can occur when shots are always given in the same place. So very, very important thing to know is you need to rotate the injection site of your insulin to avoid a buildup of fatty tissue that can occur when shots are always given in the same place. Fatty tissue buildup can change how quickly insulin is absorbed from the skin, which may in turn affect blood sugar levels. So that is our lesson about insulin. I hope you have acquired valuable information that can help on your preparation in challenging your registration exam, which is your NCLEX-RN. And I see you in the next video.